A very good evening all. I'm Aditi Lamba with the Wednesday night edition of South Asian News. Welcome to Vision of Asia, the voice of our community. We are coming to you from our studio here in New York City. Here is what's happening tonight in the coronavirus pandemic. Global number of COVID-19 cases has topped 10.5 million with at least 512,000 deaths. In the United States, there are nearly 2.7 million cases with more than 127,000 deaths. Again, a sobering number. The U.S. continues to be the hardest hit country in the world. We are looking at a switch of the epicenter of the disease here, which has now moved from the northeast, New York, New Jersey, Connecticut, to the west and south, especially states California, Texas, Florida, and Arizona. The surge comes while country deals with reopening to combat economic ramifications of COVID-19 while containing the novel coronavirus. Across the country, 37 states are reporting rising number of COVID infections and 19 states have paused or rolled back their reopening as a result of the spike. Some states with hotspots are taking action in an attempt to reduce crowd by shutting down bars, closing beaches, and canceling fireworks display for the upcoming 4th of July weekend. Governors in at least 6 states have ordered bars closed, and in New York, indoor dining will be postponed. Top health official Dr. Anthony Fauci has offered a bleak warning saying that Americans need to take sensible measures to curb the spread or risk seeing 100,000 new cases a day, and said that turning it around will take a coordinated, collaborative effort. He also said that the congregation at a bar inside is bad news and that we really have got to stop that. As this holiday weekend approaches, we'd like to remind our audience to take all safety measures, practice social distancing, wash your hands, and wear masks to contain the spread of the virus, and also follow the guidelines of the CDC. We have tonight much on COVID-19 measures, impact, and update featuring key elected officials as well as medical professionals. If you are a South Asian medical professional working on the front line in the current hotspot states, please reach us with your story, your experience on events@itvgold.com. Also calling all essential businesses to share their perspective. With that, let's begin tonight's episode and take a look at the headlines. Acting Queensborough President Sharon Lee on Black Lives Matter, DACA ruling, and COVID-19 resources, New York. Dr. Sunil Parekh on Site Saving Academy of India, COVID-19 relief efforts, New Jersey. Akshay Patra USA virtual gala recipe for change raises $500,000 featuring Sanjeev Kapoor, actor Boman, Irani, and Vinita, Bali. It's time for a short break on Vision of Asia, Voice of the Community. We'll be right back. Welcome back. I'm Aditi Lamba and this is Vision of Asia Wednesday night episode. Let's begin the episode taking a look at the latest in the coronavirus impact, measures, and resources. Today, New York reported its lowest 5-day average in COVID-19 hospitalizations since the start of the pandemic, even as the state is delaying some of its reopening to contain the spread of the virus. Both Governor Andrew Cuomo and Mayor Bill de Blasio have announced that indoor dining will not resume while it enters phase 3 on July 6th. Looking at the New York City, we recently spoke with acting Queensborough President Sharon Lee discussing much on the ongoings in the nation, from Black Lives Matter's continuous demonstrations to Supreme Court's ruling on DACA and COVID-19 impact. The Queensborough acting president talked about Queens as one of the hardest hit boroughs of New York City and its ongoing efforts to stem the tide of food insecurity exacerbated by COVID-19 pandemic and economic emergency. She also urged all to reach the borough's office for its COVID-19 response and resources. Here is Acting Queensborough President Sharon Lee. You know, there's a lot to discuss right now. There's so much happening in the nation, especially in New York City, in Queens. I kind of want to go right into it and address a few of the national topics that are really impacting all communities across the spectrum. Number one, I have to ask you, the entire movement of Black Lives Matter, we have seen over a month of demonstrations and protests happening all across, especially a lot in New York City. What has been the borough's response to these demonstrations and these protests, and what do you have to say to the entire movement of Black Lives Matter?
I think the momentum is long overdue, and it is something that is absolutely welcome. Certainly here in the borough families. The uprising is something that has been going on for quite some time. Police brutality is nothing new, unfortunately. But in terms of the momentum for change, being able to deliver change expeditiously is something that has been overdue and is something that hopefully will be able to continue. I think my small role and many folks' small role in this is to do everything possible to prevent anything that would extinguish this momentum, because these are important conversations that are being had. It is a rightful and righteous movement and protest. But in Queens in particular, you know, I think we're setting an example here in Queens where we are able to protect and preserve the exercise of First Amendment while maintaining public safety, but also delivering justice without delay. Yeah. As we can see just in I think it was just the last 2 weeks, you know, there was an incident of an alleged chokehold being used on a Black man in Far Rockaway. And within 24 hours, the department suspended the officer without pay, launched investigations, and that's plural. The charges against the person who was arrested were dismissed, all within 24 hours. Within less than a week, charges were filed against that officer who exercised what is now the banned illegal chokehold. And it's just remarkable because that incident happened in the wake of the signing of the Eric Garner Anti-Chokehold Act. I mean, the ink wasn't even dry before this incident. And so here in Queens, we were able to move very swiftly, I'm proud to say. And I don't think that would have happened without the uprising and the protest and the momentum that the protests have at this point in time.
Have done. I know the Queensborough office has supported the DACA ruling as well as the ruling for the LGBTQ community. I would like for you to address those two rulings and why was it so important for you as the Queensborough president to showcase support and also commend the work that the Supreme Court is doing.
I think the work that the Supreme Court is doing is actually affirming that the nation has gone so off course. The makeup of the Supreme Court as it stands now, conventional wisdom would be, it's a conservative court, or it's, we've got some justices there that I don't believe should ever have been confirmed, notwithstanding Justice Kavanaugh. But that being said, despite the makeup of the Supreme Court, for the court to have come down with rulings in recent weeks that affirm our fundamental rights, affirm, and if anything, challenge or check some of the abuse of executive power, which is precisely what it's designed to do. That has been refreshing. It's been, I think, gratifying for a lot of Americans. And it's been gratifying for a lot of residents of Queens County. But there is a little bit of pushback that we are very concerned about, that we're monitoring very closely.
There is a lot of work that has gone into the economic ramifications and the healthcare ramifications from the Queensborough. If you could give us an insight into all of the work that is happening currently for small businesses, as well as looking at the food insecurity issue of Queens, I think that would be great.
The food insecurity issue is something that is a bit unrelenting here in the Borough families, and I'll be perfectly candid with you. The lines around the food pantries are at the same, deep end, if not getting longer by the week. And I think when we look forward, when we look at the potential expiration of unemployment benefits, when we look at the potential expiration of the moratorium on evictions, when we look at, we are racing against time for the economy to come back, but also in the midst of a pandemic that is very real across the country. In at least half of the country, we are seeing spikes that are deeply disturbing and concerning. And so a lot of our reopening phases here in downstate New York, in the city of New York, it's been a moving target. As we speak, we are discussing whether to proceed with phase 3 on Monday, or perhaps we scale it back. There are some concerns about indoor dining and indoor activities, and the risk of reopening too quickly, and how much of an appetite do we have for a risk on human lives, for a risk on our economy. And there are very difficult and tough decisions that are being had, and very tough discussions being had. That being said, I'm seeing a lot of activity on the streets. Parks are open, businesses are trying to open or stay open, but we know that it's not sustainable at its level, right? For businesses that are opening or have opened recently, they're not quite turning a profit yet. And so that existence is not sustainable in the long term. It's almost a triage situation right now, but there has to be a lot more done to see us through beyond July, beyond August. And we know that July and August are going to be a do or die situation for a lot of the local businesses.
More on COVID-19 response and relief efforts now. We take a look at the Sight Saving Academy of India with its focus on preventing blindness and diabetes. The non-profit works to eliminate all possible sources of blindness from underserved communities in order to improve the overall quality of life, especially in rural India. But with the rising cases in the United States as the hardest hit nation in the world, the Sight Saving Academy of India has currently redirected its effort to COVID-19 relief and community intervention during this pandemic. From PPE supplies to food for medical workers and community awareness, the organization is trying to provide much needed help and continues to empower the community. We spoke with founding chairman and president of the Sight Saving Academy of India, Dr. Sunil Parekh. Here's what he had to say. Today we have you here with us to talk to us about the Sight Saving Academy of India and some of its incredible works during COVID-19 and all of the relief efforts that you're doing. So just going straight into it, the chief mission of your organization is to, save and prevent blindness and diabetes, but you have redirected your entire efforts currently to community intervention with COVID-19. Dr. Parekh, my first question to you would be, could you tell us a little bit more information about the Sight Saving Academy of India and all the work that they have been doing and how you had to change it to help COVID-19 relief?
Yes, thanks to ITV Gold and thanks to Dr. Parekh for supporting always the community awareness and important intervention in any crisis or emergency. Sight Saving Academy of India was started in 2004 in an aeroplane from my trip to Chicago to New Jersey, and with cooperation from Mr. Harris Shah, Annu Kapoor, Sundarani Eye Hospital, we established a non-profit in a couple of weeks when we heard about the crisis in Agra, about providing prevention of blindness effort. And since my team in New Jersey had years of experience in prevention of blindness, I am retired, but I was the state director for prevention of blindness for New Jersey for more than 20 years. And we started the project in Agra, and then we expanded to Dahod and Goraj and Godhra and Sargur. So our main focus is, even though on a small project, we want to impact people with diabetes, people who are in need and have glaucoma or cataracts, and with very simple and understandable interventions, we can make a big impact, especially in India. So SAI, SSAI, is mainly focused in India, and we have achieved many milestones by creating this Sight Saving Academy.
Right.
By end of February, while I was working with Dr. Meena Murthy and South Asian Diabetes Center, we were discussing about COVID-19 pandemic before even anybody else knew. And I discussed the whole problem with my SAI team, and they agreed to change the focus temporarily 100% on COVID. And we started our journey in COVID prevention and reduce its impact on community. And we were thinking about building the capacity, and gradually and slowly, from 6-7 people, we have become team of 80 people at SSAI. So our main mission is to help people.
But with reopening happening in several parts of the country, would you recommend people to go on subways, to restaurants, to salons and stores and others when we are seeing all of the cases also spike up?
Everything can be done, but it has to be done safely.
Right.
And make sure we do not infect anybody else. So as long as we keep safe distance, wear mask, wash our hands, and if you know how to, the principle of wearing gloves, then you wear the gloves. So if we learn these simple things, we don't get tired. And I think before you go out, I would suggest that people take 3 or 4 days transition, like training at home, that just they mimic it as if they are going out, and practice it so that you do not make mistakes. My major concern, even with me, is like when we go out in the field to donate, to collect, or whatever it is even at that point, we don't get carried away, and our focus about keeping safe distance, wearing mask, because at every event, these principles are breached. I mean it.
Yes.
But let us save ourselves. Let us teach other people by setting up an example.
Definitely. Well, this was great having you here with us on ITV Gold, Dr. Sunil Parekh. And thank you for sharing a lot of the work the Sight Saving Academy of India is doing. Just one last message to our audience.
We can beat this. We can win this war. This is the biggest opportunity to donate, to give. And the return on your donation is very high. So if you want to donate your time, your expertise, your talent, money, please go to our website, stopblindness.org or sknfoundation.org, or you can call me directly, 732-822-9787. And again, I want to re-emphasize that SSAI is not political, not religious. It is a selfless group of approximately 85 people now, which is supporting the mission and objectives of SKN Foundation and South Asian Diabetes Center to help people to reduce the impact of COVID crisis. Thank you, ITV Gold.
Of course.
And Ms. Amba, thank you.
Of course. Thank you so much for joining us on ITV Gold. It's time for a short break on Vision of Asia, Voice of the Community. We'll be back shortly. Welcome back. This is Vision of Asia, the South Asian news segment, and I am Aditi Lamba. We continue now our ongoing report on the coronavirus pandemic, featuring COVID-19 relief efforts in South Asian nonprofits that are empowering communities. Tonight, we take a look at one of the largest NGO school meal programs, the Akshaya Foundation, serving over 1.8 million children across India every day. Akshaya here in USA engages thousands of its volunteers and donors to raise funds and awareness. With that, recently Akshaya USA held a virtual gala, Recipe for Change, to raise funds and support for feeding migrant families and underserved children of India. Featuring renowned chef Sanjeev Kapoor along with Bollywood actor Boman Irani and Indian business leader Vinita Bali, they raised $500,000. Till date, the organization has served over 65 million meals to migrant workers since India's lockdown began, alleviating hunger across the nation. The food-themed gala saw a great discussion on the impact of Akshaya in empowering lives even during this pandemic and the importance of giving back to the most vulnerable communities. Here are some highlights from Recipe for Change virtual gala feeding families in need.
Actually, Boman mentioned about throwing away food. And you mentioned about that there is plenty of food in the world. Is there enough food in the world? What do you have to say? Why are people still not getting food?
And some.
Yeah, actually, the world. If let's start with the world. There are 7.5 billion people, but the world grows enough food to feed 9.5 billion people. So everything else being equal, as we economists like to say, nobody should actually go hungry because we produce enough food for 9.5 billion people. But two very interesting things happen to food. And these are not my estimates. These are estimates done by several agencies, etc., including in India. So 35 to 40% of food is actually wasted or lost. I mentioned 180 million people in India are chronically hungry. And this is before COVID, and this is before the migrants started going home. The nutrition and hunger is actually worse now. FAO estimates there are about 900 million, 850 million people in the world who are chronically hungry, which means they never get enough of the calories, not through macronutrients, and certainly not through vitamins and minerals, which are the micronutrients, which are so essential for nutrition. So which is why, the first goal of the SDGs is zero hunger. And that zero hunger the world is supposed to attain by 2025. And by all accounts, we are going to be nowhere close to it.
I want to ask, Boman, you mentioned that before you went into photography, you were at a shop. Did you say that? What shop?
Yes. I'll tell you. It was my mother. When my father died, we're a family of shopkeepers. My grandfather started the business. My father ran it's a little dukan. It's a little dukan in a dead end behind Novelty Cinema in the Grand Road district, the theater cinema district. And we had a bhatti. And we had a coal bhatti, coal sega, and a tawa, and a big kacha to remove potato chips, wafers. We call them wafers. Yeah. So we used to buy potatoes, peel, slice, wash, and fry them. And I used to do that myself. Wear a bandana, and I thought it looked pretty cool in those days. And I thought, that's where I met my wife. Actually, she was the only one who thought it was cool. The others found it sweaty. And I used to fry wafers, do all that, thing. And we used to sell garma garam wafers. And it was something that I had settled down. And I think because I was a shopkeeper for so long, I needed the escape through creativity in some form. So I used to write a lot at that point of time. I used to read a lot of scripts at that point of time. I used to do a lot of acting, reading and workshopping I used to make notes. I used to observe my customers. I used to do character studies of my customers and things like that. It was great. It's just that my body and my clothes always stunk of ghee.
And this wraps up our show for the night. Remember to send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on our Facebook handle @itvgold. You can also subscribe to our YouTube channel to watch many of our popular shows for free. Thank you for joining us tonight from Queens, New York. This is Vision of Asia. I am Aditi Lamba. Take care and be well.